Hello, everybody. My name is Dr. Aamir Abbas, and today I want to talk to you people in continuation to our session on research proposal writing. I welcome to all those of you who are watching this session live, and I also welcome those who will be watching the recording of this session. Let me remove this announcement. Those of you who are watching this session live, I will request you people that if you have not subscribed to my YouTube channel, please subscribe the YouTube channel and do not forget to press the bell icon. Additionally, uh, if you want me to produce videos on a particular topic, please put that request in the comments because that is the place from where I decide what to produce in the future. Uh, so today's session is in the continuation to the series of session on research proposal writing. This will be a short session, so I will request you people to remain with me till the end of this session, and I will specifically talk to you people about what is. I will talk about the hypothesis writing in the context of research proposal writing, and we'll talk different aspects of the hypothesis, what is a hypothesis, from where it comes, and how do you write the hypothesis for your research session. So this is a short agenda for this short session. I'll be talking about the relationship of hypothesis to specific aim. I'll be talking about the connection of hypothesis with the background, and we will not end this session over there, which means we'll not end this discussion on these 2 points. This discussion will continue further in the future through the next session, but for this particular video we are only going to talk about these two aspects of the research hypothesis writing in the research proposal. So first of all, without any further delay, we'll talk about the relationship of hypothesis to specific aim. One important point, or a few points which are important to note over here, are that there is something which we call as the specific aim in the research proposal, and there is a separate entity which we call as the hypothesis. Now there is a process to formulate or convert the specific aim to a hypothesis, and that process is needed to be understood. One important thing about that process is that it is so simple that some of the authors or epidemiologists have used the word being deceptively simple, which means that the process seems so obvious or simple that you kind of get deceived by the simplicity of the process. So it is very important that you understand the subtle differences between the aim and the hypothesis. When I'm talking about the aim, I'm talking about the specific aim. There are very subtle differences between the specific aim and the hypothesis, and I will try to make that clear in this and the subsequent videos. So, what is an aim, or what are the aims in a research proposal? These are a list of tasks that the investigator proposes to accomplish in the research work. So, this is the definition of your specific aims. And what is the hypothesis? In this video, I would want to emphasize on two particular aspects of the hypothesis. First of all, hypothesis identifies two factors, and I will say it outlines the specific factors which we are talking about. It specifies the exposure of the outcome variable in your aim or your research question, but it specifies those two factors. And the second important point to understand in the context of formulating a hypothesis is that it clearly and explicitly makes the direction of the relationship clear, which means that whether what increases or decreases, which for example, if we take the example of smoking and lung cancer, uh, we will say, okay, there are two factors: one is smoking and one is lung cancer. Okay, that is one thing which is clear in this example. And second is, what is the direction of the relationship, right? It is obviously we will hypothesize a positive direction, which means if smoking increases, the lung cancer will increase. So that is the two things which will be explicitly made clear in the hypothesis. When you're formulating a hypothesis, or you're converting a specific aim to a hypothesis. As I said, that this is a very subtle difference which people tend to ignore in time, and this is so simple that is deceptively simple. Now, the next point is, how do you come with a hypothesis? You come with a hypothesis through a comprehensive review of the literature. Okay, you review the literature, you identify what has already been done in the literature and what has not been done, which means that you see a lot of papers, and you see that, okay, this has been done, and the papers have mentioned that we were not able to explore this particular aspect, and they mentioned that in the limitations of their limitations, and those limitations are your future research questions, your aim, or your hypothesis. And from there you can specify your hypothesis. And one important point to emphasize over here is, uh, a clear hypothesis is very important. A clear hypothesis shows that you have a grasp on your literature review. If you have done an exhaustive and extensive literature search, that means that your hypothesis will become crystal clear, and that will take the literature a step forward, and it will contribute to the scientific knowledge. Moving forward, I have to make a disclaimer at this point. Most of the information which I'm sharing over here, and particularly to be very much specific, I mean the examples which I'm using in these sessions is from this book. This is a very good book, which is whose title is Writing Dissertation and Grant Proposal. Its snapshot is over there. You can find it, you can purchase it, and I really like the way it has been written. So I will be using the examples to communicate what I want to say. And these examples are taken from this book. The first example which I want to show you is, for example, you have a specific aim to evaluate the relationship between pregnancy stress and risk of adverse birth outcomes. This is your specific aim. Now, what we want to do, we want to convert this specific aim to a hypothesis. Now, you need to be very much careful. Okay, I would request you people that if you are not able to follow this particular point in a single go, please try to see this video again and try to see the difference in the wording of specific aim and the hypothesis, and then you will get to know the subtle difference between specific aim and the hypothesis. So if I want to convert this particular specific aim into a hypothesis, then this is one way to do it, which will be, the hypothesis will be that there will be a positive association between pregnancy stress and low birth weight. And as you can see on the screen, I have highlighted a few words. For example, I've highlighted the word positive. Why I've highlighted the word positive? Because that is the word which is showing the relationship, whether there is a positive relationship, there is no relationship, or there is a negative relationship, right? And obviously, when you're making a hypothesis, you intend to claim that there is some relationship, so there has to be a positive or negative relationship there. And the two factors, which the exposure is hypothesized to be pregnancy stress, and the low birth weight is hypothesized to be the outcome. So that is one specific example in this context. We'll talk about another example, and that is to evaluate the relationship between pregnancy stress and hypertensive risk hypertensive disorders of pregnancy. So this is the second hypothesis. This is the second specific aim, and the second hypothesis coming out from this specific aim can be, again, I've highlighted some of the words which are important in the context of the specific aim, and then which are important in the context of hypothesis. For example, again, we are hypothesizing that there is a positive relationship between the exposure and the outcome, and the exposure in this case is hypothesized to be the pregnancy stress, and the outcome is hypertensive disorders of pregnancy. So in this way, you can convert your hypothesis into your specific aim into a hypothesis. Going forward, another important reason to include your hypothesis within your research proposal is that it clearly communicates the overall impact of your research proposal. For example, if somebody is reviewing your research proposal, if I'm reviewing your research proposal and you propose something to me, I'm interested in your research question, your specific aim, and the hypothesis as well. But what I'm more interested in is that when the findings of your research come, what will be the impact of those findings on the public health or clinical guidelines? And that is what the hypothesis will give a clear idea. And I'm going to talk about this in subsequently as well. For example, there is a hypothesis that there will be a positive association between pregnancy stress and low birth weight. Let's assume this is my hypothesis. So, what will happen? The form, if I'm able to uh, reject or I'm able to prove my claim which was made in that hypothesis, what will the implication of that particular hypothesis will be the formulation of programs to reduce stress during pregnancy to avoid low birth weight among babies. So that will be one of the public health intervention which will be um, coming out from the proposed study. The second point which I want to make through this short video is the connection of hypothesis with the background. Uh, this is going to be what happens is that when you make your hypothesis, it should directly flow from the background of the proposal. What does I mean by that? What do I mean by that? Uh, you do the review of the literature, okay, and what happens that in reviewing your literature, you identify multiple studies, and some of those studies uh, are done in related areas. But what happens that in those studies, limitations have been mentioned, and when they talk about the limitations, those limitations are the gaps identified in the literature, and those gaps can be filled with the help of a hypothesis. And in that way, uh, your hypothesis should be coming directly from your background, which you have written in your literature search in your research proposal. Suppose that you are interested in relationship between vitamin D and depression, and the literature has only talked about the short-term impact, which means that there is a gap in the literature, and the literature has not talked about the long-term impact of this relationship. So your hypothesis potentially can be to study the long-term impact of uh, this relationship. So I want to divide these concepts into chunks of small videos so that I'm not overloading with you with information. But there is a lot to be said in the context of making hypothesis uh, within your research proposal. I will continue this discussion in the subsequent session that will be announced through my YouTube channel. And I would request you once again, if you like this video, please press the like button. If you haven't yet subscribed to my YouTube channel, please subscribe to my YouTube channel. Do not forget to press the bell icon. Please provide me with the feedback in the comments. And if you want me to produce videos on some specific aspects of or some specific topic, please put those requests in the comments as well. Take care for the time being. Uh, Bye.